Have you changed doctors ever? How have you negotiated this space for yourself?
For me personally, I think of it as, am I going to choose the best healthcare that I can have and that I deserve, or being shy about speaking up?
Welcome to LCFA's Living with Lung Cancer, Ask Me Anything podcast, where we have real conversations with people living with lung cancer. Learn from personal journeys and expert insights. Subscribe now and never miss an episode.
I'm Annabelle Gurwitch, and welcome to Living with Lung Cancer, Ask Me Anything. And on this podcast, we are going to have conversations that we would normally have if we weren't being recorded. And my guest today is Colette Smith. Colette, you are a mother, you're a grandmother, you're a professional, you are also someone living with lung cancer, so we've got a lot to talk about.
Let's do it.
All right. Okay, so to introduce our topic today, I'm going to tell you a little story. And here's my little story for you. So I switched oncologists. It's been about a year now. And I go to see my new oncologist, Dr. Ravi Salgia. Let me just say his name. He's so fantastic. And it's my first meeting with him. And I asked the question because I'm someone who's diagnosed at stage 4 with EGFR mutated lung cancer. I'm still on my first line of treatment. I've been so fortunate on the biomarker targeted therapy, Tagrisso. And so I said, so I'm stable right now, but I'd like to talk about what you think might be our next plan B as we see it right now, because the science is always changing. And he said to me at first, he said, I am right there in the, we do clinical trials here. We stay abreast of everything. We'll keep track of this, and don't you worry about that. We'll let you know when the time comes. And I said, that's not going to work for me. I'm that patient who really, I do my research, and I want you to know I'm not going to bring things from Dr. Google, but I will be asking you questions based on my knowledge of what's happening in the world, what trials are taking place, and where the science is moving. Is that going to be okay with you? That I'm going to want to make decisions together, and I'm going to be asking you questions. And he said, oh, absolutely. Everybody wants to do things different ways. And he said, that's what we'll do. We'll make decisions together. And I thought, okay, I have found the right doctor for me. However, I couldn't have had that conversation a couple years before. That's not how I started out. So that's my way of saying today what I want to talk about is communicating with our doctors. Are we speaking the same language? How do we speak the same language? How do we get to find our voice with them? So I'm going to ask you, have you changed doctors ever? How have you negotiated this space for yourself?
For me personally, I think of it as, am I going to choose the best healthcare that I can have and that I deserve, or being shy about speaking up? The best healthcare I deserve. That's how it has worked for me. And I realize that everyone may not have that courage, but you owe it to yourself.
So what does that, let's talk about, what does that mean? What does that look like? And was this something you've learned since you've had lung cancer, or is that for you something that you came to it with?
Maybe a little bit of both. Lung cancer has given me a set of balls that I didn't have. I'm like, this is the worst thing that has ever happened to me.
Yeah.
I am not going to spare hurting a physician's feelings because I'm feeling bashful.
Right.
And it could be some of my life experiences before. I'm one of 13 children. I've had to claw my way
God.
through
Okay.
everything, hand-me-downs,
Right.
and everything else.
Right. See, it's very interesting. I think, we all come, if you're diagnosed with lung cancer or really any chronic disease, one of the things that distinguishes this kind of experience is we're not in the situations where you're like in a one-off. Like for some people with different kinds of medical journeys, you're looking at, okay, we've got a situation, we have to triage it, and then it's going to be done, and maybe you'll have some effects the rest of your life, but there's like a definite beginning, middle, and end. For many chronic diseases, as we know, and for lung cancer, this is not typically the case. I see my oncologist more than I see most of my relatives. So one thing I have come to see, and I wonder what you think about this, is, there's no perfect. So do you have like a set of criteria that you evaluate whether someone's right for you or not?
For me, communication is important. I must feel comfortable and at ease with asking questions. I don't think any questions is a silly question. And if I feel that my questions are not being addressed, it's a no-no. What I also do is I have 3 different oncologists, and they know about each other because I shop around, not to change physicians, but I go looking for the science. My physicians are aware of second and third opinions that I've gone for. And that has worked well for me because my physicians have also changed facilities. So in the event of a life change, I have someone down the pike who knows my history and is familiar with my history that I check in with like once or twice a year that I can easily transition to. I plan ahead a little bit.
And Colette, do you follow the science, or what do you do like to stay abreast of things?
Well, for one thing, I follow the science of my particular mutation, EGFR exon 20. I found an oncologist who does research in that specific field. And it's through a lot of research. But I found that person. I'm not switching my care, but I check in with that person at least once or twice a year. So I look to see what's being done. I've had conversations with her about the other nodules. I learned about a drug that's just left stage 3 clinical trial. It's on the market now. So I have a game plan.
And
if
do you
I should need it.
bring that up to your doctor? Will you say things like, "I've learned about this drug. Is that something I am eligible for?"
Absolutely.
That's
Absolutely.
fantastic.
And
Yeah.
I let that physician also know where I got the information. I'm open.
Yes.
Create some healthy competition, if you will.
Every week on Living with Lung Cancer, Ask Me Anything podcast, we explore questions that matter most to people living with lung cancer. We talk about new treatments, everyday challenges, new research, and we share the stories of patients and caregivers who are finding hope and strength. If you want these insights delivered straight to you, subscribe on any of the podcast platforms or go to lcfamerica.org. And if you know someone who could use some understanding or encouragement or both, share this program with them. And don't forget to subscribe. Now, back to our conversation. I actually heard a prompt from Dr. Jorge Gomez that is something I think is really useful for patients in talking to their doctors, and I want to try it out on you.
Okay.
Tell me what you think.
Go ahead.
All right. So the language that he suggests patients incorporate when they are talking to their doctor is to, and it requires some thinking before you get there, but to say, "This is my goal," or "This is what's important to me. How close can you get me to that goal?" So when you unpack what that prompt would mean, you would think in advance, what is that goal? So maybe for one person, it might be, my goal is to wipe this thing out as quickly as possible. I don't care what I'm able to, to withstand anything. I want a cure. How close can you get me to a cure? Then the doctor can say, well, maybe there isn't a cure, but we can get you as close as possible. We can try for no evidence of disease, or we can try to shrink it as much as possible, whatever's going on in your body. So that might be a combination therapy, or the, trying to tolerate as high a dose as possible. But for someone else, that prompt may sound like, let's say I'm 85. My goal is to travel. I've retired. I want to travel. I want to do the kind of treatment that is going to make my life as much as exactly as it is now. So that's my goal. How close can you get me to that? To be as unaffected by this treatment as possible while still, trying to control this disease. Well, that might mean maybe a monotherapy. So that kind of prompt, this is how I want to live. How close can you get me to that? This is my goal. How close can we achieve that? I think that's very useful. What do you think about that?
I like that. And I think what it's expressing is, this is my body and this is my choice. And to determine whether or not we are aligned as physician and patient, is this something you can work with me on? I like that prompt.
Oh, I have to ask you a question. When you go to appointments, do you take notes?
I do not. I don't take notes.
You don't do that. Do you record the appointments?
It depends. It depends on what the conversation is going to be, and I ask for the physician's permission to record. I try to, instead of taking notes, to stay engaged in the conversation. I may have notes before of specific questions that I have. It depends, especially if a scan is being repeated. I got tons of notes, tons of questions that I'm going to refer to. Why is this being repeated? What did you see on the last scan that's causing you concern now? Why? What are you looking for precisely? I have tons of questions, and usually my questions are met with answers.
Because if they weren't, you would not be with that doctor.
Of course not. No.
Do you bring people to your appointments with you?
I do not. It's nerve-wracking for me personally to do that.
It's really interesting because there's different strategies about this. I like to go by myself, primarily because this is my way of making my lung cancer treatment a part of my life. I feel like if I do this like in a way my job, it makes me feel less like it's dominating my life. I'm also worried when someone comes with me, I feel like I have to take care of them, particularly if it's a family member.
For me personally, I've taken my husband to appointments before diagnosis. And he doesn't cooperate with going like, I want him to get there with me. Like, I'm upset. I want answers. Come on, let's go in and be upset and get answers together. Nope, that's not his personality type.
That's so funny. That's so interesting.
No, I leave him at home.
That's interesting. I think we have to educate our providers about this, because I always find that they seem surprised that I'm there by myself. I don't know if this happens with you, but they usually say things like, did you bring anyone with you? There's an expectation that makes things easier. I challenge that expectation. And I think that we have to think a little bit out of the box in terms of really what works for you. How do we what's going to be the most empowering position, or what's going to be the way of dealing with it that's going to make it smoother to be part of your life and not overtake your.
Yeah. If it's a tough appointment where I'm getting news that I wasn't expecting,
Yes.
I want to get it by myself,
Yeah.
process it, and then explain in my own way, or be able to think on the travel home by myself and not have to have a conversation with someone else.
Yeah. I mean, I want to acknowledge that, people are impacted in many different ways. And, I feel really lucky that I get to go by myself. And that's a privilege of the benefit of science that the TKIs have allowed me to do that. It has a few times backfired. There was one instance when I was at the hospital where I receive treatment, and I tested low for a blood oxygen level, and I had to. A couple of things were happening. As now I'm on an IV. Now I'm being rushed into a scan. I was so nervous I had to take a Klonopin, and then call my boyfriend, who did not know I was actually going to the hospital that day, and say, "Hi, I'm drugged up on a gurney, and I might not have mentioned that I have such close monitoring of my health, and I'm an hour out of the city. Could you take an Uber and pick me up and drive us back?" There's some conversations that had to be had there that I wasn't expecting. So it's a privilege of science and of advancements in care to get to do that, and I don't take that for granted. So I agree. Very
I like the
lucky.
solitude of going
Yeah.
and having these appointments on my own and being able to think things through afterwards or before, and then calling and say, "Oh, everything's fine."
I'm really glad we talked about this today, Colette, and I want to thank everyone who's watching or listening and encourage you to get that patient-provider communication, and also to reach out in our lung cancer community if you're concerned about how to stand up for yourself, or what kind of things you can expect. Or maybe, sometimes when I talk to a mentee, I'll say, I'm not sure that's a reasonable expectation from your doctor. Because, we sometimes, I think we have to also think about what is reasonable and what's not reasonable. Because, we all want a cure, and there are different things that are available for each of us. We're going to post some show notes about this topic, and we'll have more information at LCFA's website, also at my website, AnnabelleGurwitch.com. Thank you for being with us today. I hope this has been a conversation that you really won't hear anywhere else. And I urge you to have those conversations. And if you like the podcast, leave a comment, leave a little star or whatever that is on Apple, and subscribe. And we'll see you next time.
Thank you.
Thanks, Colette. Thanks for listening to Living with Lung Cancer, Ask Me Anything. I'm Annabelle Gurwitch. If today's conversation helped you, follow, subscribe, share this episode with someone who might need it. Together, we can change the way we talk about lung cancer. And if there's a lung cancer related topic you want us to explore, let us know in the comments. Find out more at lcfamerica.org. You can find me on the socials or at my website, AnnabelleGurwitch.com.